Sports-related concussions for student athletes are a growing concern, and the topic's getting lots of new attention. We're now told the rate of concussions is on the rise. But is it really? We'll find out and get much deeper into this topic, but first, welcome to this edition of Central here on Fox. I'm Daniel Pluff. Glad to have you with us as we get into a topic that's really quite timely, both in central New York and across the country, for young students playing sports, parents of students playing sports. It's a pretty popular topic right now, and we'll get into some details on this. We do have two very special guests that will walk us through the entire topic, I hope, in the time allowed. First, from Upstate Medical University, we have Dr. Brian Rieger. He's director of the Concussion Center at Upstate and also chief psychologist and clinical assistant professor. You're probably smarter than me, is what you're saying, right? Is that what you're just trying to...
I don't know about that.
Oh, I think so. But welcome, Dr. Rieger.
Thank you.
You're very well versed in this topic. We're glad to have you. A lot of medical advice tonight, I'm sure, as well. Also joining us, someone with a little bit of background in the issue as well, Mark Powell. He's the head athletic trainer at East Syracuse Manoa High School, also a strength conditioning coach for the Syracuse Crunch squad. So, Mark, welcome to you, and I know you'll have some thoughts on this as well.
Thank you.
I might need some strength training tips at the end here as well, so don't go anywhere. This really, we couldn't have timed this any better because it's not a new topic, certainly. You'll both agree to that. But boy, it's been in the news a lot lately. Movie is coming out on the whole topic here pretty quickly. It's in the news. And I guess before we get too deeply involved, Dr. Rieger, without killing me with the medical jargon, we need to identify what a concussion really is. I mean, we know it's some impact to the head. What happens? I mean, what is it?
Well, there's probably the most important thing to know about a concussion is that while there usually is an impact to the head, not always, but most of the time, the defining characteristic of a concussion is that it's an injury to the brain. So the head may also be injured, but the key thing to understand about a concussion, we call it a mild traumatic brain injury, and it's characterized by a disruption in the brain's functioning caused by a blow or a jolt to the head.
The brain moves in some regard?
The brain is floating inside the skull. And as I like to say, you can put a helmet on the head, but you can't put a seatbelt on the brain.
Right.
So anytime there's acceleration and then rapid deceleration or stopping of the head, such as in football or other sports, motor vehicle accidents, falls, the brain is thrown around, and the motion of the brain moving inside the skull leads to a very characteristic injury.
Mark, I'm not taking any credentials away from you, but you're not a doctor like me.
No, I'm not.
So when you suspect concussion, I mean, how do you know? What are you looking for? Is there some, for lack of a better phrase, is there some field test that you perform?
We talk symptoms with the athlete. So we're looking for a headache, we're looking for dizziness, we're looking for blurred vision, double vision, we're looking for a ring in the ears, we're looking for neck pain, numbness, tingling, any loss of function, slurred speech would be something. When we talk to them about, hey, where are you? What happened? Do they know what happened?
You ask some basic questions. You've seen this on the sidelines of games, right?
For sure. Basic questions to find out where they are. Are they answering questions quickly and snap, good answers, or are they kind of have to think about it?
But here's a problem, and boy, I'll tell you, you guys would both be proud of me. I read 92 studies on, good grief, there's no lack of studies on, but some of these symptoms can be delayed. It might not show up immediately, quote, on the field, correct?
Right.
So, how do you diagnose or determine?
One of the things with our concussion protocol is to, if a kid does have a blow and gets, for lack of a better term, stunned, say, we're going to pull that kid out, and we're going to let him sit and relax and let the adrenaline kind of calm down, because every kid, I'm ready to go, I'm fine. Well, let's get past that and then start to talk to them and find out what their symptoms are.
Doctor, how long can it be before symptoms present themselves, as you folks say?
Well, typically you see something right away. Sometimes that can be very mild, though, and it may seem to go away. And that's the challenge for Mark on the sidelines. Mark was talking about signs and symptoms. There's really no medical test to diagnose a concussion. Still, the best way to come to the conclusion that a person's had a concussion is by an evaluation of what they're reporting, and then some testing of brain functioning like balance or cognition.
Sure, and of course, anybody, at my age, we could all sustain a concussion. We're going to focus, for the most part, on this show on student athletes, the younger demographic. Do we treat student athletes differently than adults in this regard?
Well, I don't think that we should treat student athletes different, only in the sense that there's some research that shows that high school athletes may take longer to recover. They also are more engaged in sports than a lot of adults are. So there is a higher risk that they may have a prolonged recovery, and in a sense there's a greater risk that they might go back to sports too soon. And that's really what we try to focus on with our management of
Interesting
concussion.
you say that. Let me bring up a graphic here first. I want to talk numbers with you too, because let's talk about where the incidences of concussion are occurring. And this is from, I believe, the Centers for Disease Control in Atlanta says that football, I don't think I'm surprising the two of you, football has the highest rate per 100,000 students, coming in at about 70 some odd concussions. Boys ice hockey coming in number 2, and boys lacrosse is second on the list. Mark, we'll talk football, of course, that gets the attention, but boys hockey, is it head-to-head problem, or is it head to ice? Is that the issue there?
It can be head-to-head, it can be head to ice, it can be head to the glass or to the boards. If they fall along the boards and hit their head on the glass going down or on the boards going down, and the board has a little bit of a jut out to it. So there's any one of those ways.
Football getting so much attention, Dr. Rieger, is the game just getting too dangerous in your view?
Well, I think there's been certainly a lot more attention to the extent of head injury in football, to the culture of minimizing the concern about concussion in football. So I think there's an explosion of attention in research, but I think it's too early to know where we're headed with football. It's clear that some people don't really tolerate hitting their head a lot. It has bad consequences for them.
I would think, yeah.
But there are some people who seem to tolerate hitting their head a lot, and we don't have any way to know who's who right now.
Not on the list, and I don't know who, maybe Mark, to you, but not on the list in the top 10, I think even, was boxing. Now, when the object is for me to hit you in the head, but maybe because there's fewer boxers as opposed to other sports, do you think? Or I mean, you would think the concussion rate in boxing has got to be quite high.
I'm not sure boxing's counted in those statistics necessarily if they're talking about like high school sanctioned sports, so that might be one issue there.
There you go. Yeah,
I think
it's got to be it.
Because actually,
it's got to be it.
Because actually, equestrian sports actually, I think, have technically, if you think about sports and recreational activities, I believe equestrian sports actually has the highest level of head injury.
We focus again. Football tends to be more of a boys' sport, right? I mean, hold the emails, but it tends to be more on the boys' side. Mark, you were quick to point out we don't discriminate here, because look, the next 3 top areas in terms of rates of concussion: girls soccer, girls lacrosse, girls field hockey. This is not a disease, but this is a problem that does not discriminate between boys and girls. You see it with women, girls.
No, and it's important for the parents to know that it can happen, and just like with football, we're trying to minimize it. But you've got a soccer goalie punts the ball, it goes 30 yards in the air and 50 yards downfield, and somebody's going to head that. There's got to be trauma to the head on that, and again, probably some more than others. But and lacrosse, you've got sticks and balls that are hitting girls without helmets, and helmets isn't the answer, but for girls lacrosse, but those kinds of things happen.
Go ahead.
I also wanted to say, interestingly, girls have a 10% higher rate of concussion in sports played by boys and girls with the same rules. So basketball or soccer.
So why
and
is
the
that?
Theory, because I was thinking about this when Mark was talking about the goalie punt that gets kicked 30 yards in the air. One theory is that the neck strength of girls relative to the mass of the head and brain is a little lower, so there's more vulnerability to the head moving and thus throwing that brain around. There's also some research indicating that there might be actually some hormonal differences related to that.
And I thought of something else too, Mark. And this is a serious question. It's by no means any trying to make light of something, but I wouldn't think about cheerleading as a quote sport where you get concussion issues. I'd be wrong.
You'd be wrong.
Definitely wrong.
A lot of jarring, jolting. You know, they're trying to do stunts, and they'll fall and land. You know, they might hit each other. You know, it's not when they're standing on the ground clapping and cheering. It's when they're trying to do stunts and throwing the girls in the air, catching them. You know, or holding someone up, and they kind of lose. And
Right.
you know, again, they fall, and their heads, as Brian said, just jolting the head versus necessarily smacking the head.
I
or
promise.
hitting
I
the
promise you, we'll be talking about how to prevent some of this in a minute too. But there's one topic I want to weave in and out of, and I want to end with it later in the show. But I'll open it up here a little bit. You know, they're talking about rates of concussion being on the rise, et cetera. But some people are saying we're making too big of a deal of this. And yet then I saw another study that says sports-related brain trauma incident second only to motor vehicle crashes for young adults. So it's obviously a problem that you're seeing. I mean, should we be more concerned or less concerned about what's going on?
I think that's the question of the day, Dan, really, to be honest with you. When I started our concussion program, you know, over a dozen years ago, we were really trying to get people to take this more seriously. I do now, though, see, you know, parents coming in who really, you know, feel like their child's had one concussion, they got over it in a few days, but they pretty much don't want that person to go back to contact sports. And I don't really think that's right either. So in some cases, I think maybe the pendulum has swung a little too far, but there's no question that a good outcome of all this attention is that when we do have that athlete where we suspect they have a concussion, we're leaning more now towards pull that athlete out, sit him down, watch him over that 24 to 48 hours where symptoms might worsen.
Right.
And then make your call.
And you're moving into my next chapter here, which is sort of the protocol of it, but just two quick questions on this as well. You might have said earlier, which was a surprise to me, one thing that bothered me was a high percentage, 90% maybe of concussions, diagnosed concussions, occur without the loss of consciousness. And yet you think a concussion is, you know, you're out on the mat, right? That struck me as odd.
Yeah, when I talk about concussion, I often make that point. If your criteria for a concussion is that the person's knocked out, you're going to miss 90% of them.
Wow.
Exactly.
But if
In
you're
sports.
knocked out, does that imply it's a more severe concussion?
It's interesting you say that. So another message that we want to get out there is you cannot judge how severe a concussion is at the time of injury. So the kid who's airlifted off the field, unconscious and convulsing,
Ew.
and I've treated those kids.
Okay.
You know, imagine being a parent at that soccer game.
I can't. That was what
They walk into my office a week later and we can't find anything wrong with them and they seem perfectly fine.
Wow.
And another kid in the same game, real story, who had mild symptoms, didn't tell anyone because didn't know it was a concussion, you know, took about 4 months to recover.
That's the scary part of it.
So we are more concerned that it could be a more severe injury if there's loss of consciousness. So that is a person we would send to the hospital for that CT scan. But if it's just a concussion, doesn't mean it's going to be
Mark,
worse.
let me, last question on this topic, and it might sound like I'm picking on you a little bit, maybe I am. I read yet another study that said those schools with athletic trainers tend to report a significantly higher number of concussions than schools without. So are you guys part of the problem, or are you doing something that...
Absolutely not. I think that it's a function of a kid, maybe kids are going to be more comfortable coming to me, coming to the athletic trainer and talking about that because they know you're concerned with their health. They may not say anything to the coach. And the coach really doesn't have the wherewithal to make those diagnoses. So you've got two things going against them. If the trainer is there, yes, I'm going to say, I talk to a lot more kids. Hey, geez, I got a little bit of a headache, and the younger kids, some of them are afraid, I might have a concussion. Well, okay, let's talk about it. And you know, just because they have a headache doesn't mean they have a concussion, but we have to talk about that. And that, you know, that person probably isn't going to their coach and saying, "Geez, I got a little bit of a headache," or maybe not. Certainly, they're going to come to the athletic trainer.
Is the coach typically the first checkpoint or stop if there's no athletic trainer involved?
Absolutely. And then if they don't
and
say
in your
anything
opinion,
to the coach,
and
then
in your opinion, are the coaches at particularly the middle and high school levels, are they adequately trained to deal with this?
They're getting better. And I know, I can only speak for my.
I'm not sure I like that answer.
For my experience, they call me or they call my assistants. That's
Okay.
So that's so we have that. I think again with the awareness now, the coach, if a kid comes and says, "Geez, I'm not feeling right. I feel lightheaded. I have pressure on my head." The coaches now have a recognition that something may be wrong.
Okay, so we're moving into the whole protocol thing. Let me address this issue. So, I'm a JD grad. You're at ESM. I figured I couldn't bring anybody from JD, and that would be conflict of interest. So we went to ESM. Let's say JD and ESM are playing. I don't care some sport, right? Yeah. Athlete goes down, and you suspect or worry concussion. What's the protocol there? You go out, you evaluate,
remove from play.
You remove from play.
They're not going to play until I tell my coaches, let's say at their away games, our coaches have to know something. I tell them, I don't want them back on the field. Then we can be assured that they don't have a concussion, and then maybe they can come back. But they're going to sit until we can determine.
But Dr. Rieger, according to you, it might take some time before we really know.
Right, and that's why we sit them. Yeah. So the law that has been passed in New York State, like many other states, stipulates that an athlete is removed from play if there's a suspected concussion.
Excuse me when I just did it. So athlete as in high school, middle school, you're not talking college?
This would be the recommended international protocol, and it's incorporated into the law. So the idea is you remove the athlete from play of suspected concussion until they're evaluated. Now, if you're a professional team and you have a sports medicine staff on the sideline, you can evaluate them immediately. If you're a coach at an away game at a school without an athletic trainer, then they cannot be evaluated on the sideline. They are out at least until 24 hours until they're evaluated.
So are you, as a physician, are you concerned though, again, from what I saw, there doesn't seem to be necessarily a consistent broad-based approach to this. For example, look at SU, just for a second here. Syracuse newspapers did an editorial, in essence, congratulating Syracuse University for disqualifying, DQing A.J. Long. And yet, now he says, maybe he'd like to transfer, go to another school and play. Does that bother you?
Well, I can tell you that this is a question I get a lot. How many is too many? When should someone pull the plug on participation in high-risk sports, whether it's football or skiing or whatever? And I can tell you there are no guidelines. We have very clear guidelines on how to manage a concussion.
Yeah.
But the advice I get, and I can send you all those articles, Stan.
Please.
But the advice that I have from these articles goes something like this. Each case needs to be managed on an individual basis based on the athlete's concussion history, symptom burden, et cetera, et cetera. In other words, it's a judgment call.
All right, so let me just stick with the controversial part of this, okay? So here's another case where the individual's name is irrelevant. Head coach at the University of Illinois was terminated because an investigation showed that he pressured athletes to play after they were diagnosed with concussion. So to both of you, maybe Mark first to you, here's the question. I mean, and again, that was football, but are some of these sports at the middle and even high school level becoming so important, so competitive, and the pressure so great for these athletes to play that we're pushing aside good protocol?
I think I can do an advertisement for having an athletic trainer full-time at your school that is that kind of go-between I'm only concerned with the athlete's health. I'd like us to win games, but I'm concerned with that.
Okay, so I don't know if you're going to answer this question honestly. I hope you do.
A buffer.
I hope you do. But so have you had a situation where you and a coach from years ago, or no name, a situation where maybe you and a coach locked horns on the issue?
Absolutely not. It won't happen. I wouldn't. I don't know. In my head, it's unacceptable. I'm the one with the health background and the medical experience, the master's degree and all of this, as opposed to the coach who really, they're coaching football, soccer, doesn't matter what they're coaching, they don't have the medical background to make the decision that I'm going to make. So they're not in a position and may sound arrogant.
No,
I
go
don't
ahead.
mean to.
I'm listening.
But if they're questioning me on it, I don't think they have any leg to stand on, and that's kind of how I've always approached it. And my coaches trust me.
But
my kids trust me. My coaches and parents trust me.
and I
to
trust
make
you,
those
and I
decisions.
trust you, and I trust your answer. But would you not agree that there seems to be a lot more pressure at middle and high school level sports these days than maybe back when we were,
It's hard to certainly at the college level, there's a lot of pressure, and I'm only speaking from my experience at my school, and the parents want the kids to get a scholarship, and they want them to play in the game Friday night and all that stuff. And I've locked horns more with parents than I have with coaches. I can tell you that.
Really?
I've got parents that don't understand, and we use the term, and within our athletic training staff, we use the term, your son or daughter may have had a brain injury, rather than we don't say, oh, they got the bell rung, and so we got to watch them a little bit. No, they possibly have suffered a brain injury, and try to get that message home to them, because I've got parents who they played football or soccer and they say, oh, I did that 10 times when I was in high school.
Doctor,
it's different now.
To something you said earlier, a 2014 study from the Journal of Medicine and Science said new evidence shows that high school students in particular, they really focused on high school students, were returning to the field too early after concussion. And again, does that get to your point, we don't know enough about when they're ready, or so what do we do about that?
I think that encapsulates a lot of factors. As Mark said, parents, the athletes themselves who feel that pressure internally, and science that isn't there yet to really tell us that a person's really recovered. More than once we've had patients who seem recovered, and then when they really, exert themselves mentally or physically, the symptoms may return. And particularly when kids go back to school, we often focus on their tolerance for exercise as a way to judge whether they're recovered. But they may be able to go out and run, all over the field and tell Mark they feel fine, and they're not lying. But they may still have a headache in math class. And if no one tells them that probably means they're not over their concussion, they don't know it, they're going to be back on the field, and we may have more problems.
So quickly, how often, Mark, to that point, how often do you find with younger athletes that are either, for whatever reason, reluctant, embarrassed, or ashamed to say, I'm having the headache in math, I'm not feeling well, because they want to play? I mean, how do you get through that?
Well, again, I think we at our school, our nurse is very involved, our school physicians are very involved. We're very fortunate in that regard, and we put together, Brian actually came in and spoke to our entire staff on a staff day about concussions. We had a lot of feedback on, I had no idea. So we tried to build in that return to learn. We talk about return to play, but we have a return to learn process. The kids, when they do sustain, they've been diagnosed with a concussion, they will be told that, geez, if you're getting a headache in class, then you need to go to the nurse, and they'll give you some quiet time. If it doesn't get better, we'll send them home. And we're in touch with the school nurse, but we're in touch with the guidance counselors. We're in touch with, we email all their teachers, so all their teachers know that they're going through this, so they can be aware of it. And it's communication.
Yeah, you see me getting twitchy here, right? Sure. So what does that mean? We're getting tight. So a couple of important points I want to hit upon. Centers for Disease Control, Dr. Rieger says that in the last approximately 10 years or so, the rate of concussions has doubled. Do you believe that statistic?
I believe that there's more reported and recognized concussions.
Oh, there you go.
And I think also there's probably, I don't know the statistics in sports, I think there's actually declining participation in youth sports, I believe, at least some of them. But overall, I think the major increase has been that people are reporting and recognizing concussion at a much higher rate, and I think that's a good thing.
But again, I'm trying to look at both sides of this. Sometimes the pendulum starts swinging. All of this talk, we're doing a show on it. Are more people going to be overly concerned about the potential or possibility of concussion? Are we putting too much attention to this issue?
I think where we see that is not so much in the recognition of that one concussion when it occurs, but I think how we then, feel about, oh, my child's had a concussion or I've had a concussion. If we manage a concussion properly, it's usually a short-lived event, a matter of a week or two, and the symptoms have gone away, things are back to normal, and we can resume.
Okay, but so this just came up today. Before you fellas got here, you met Andrew, the director. They're expecting a baby. He and his wife are already talking. Well, you know, do we allow a sport like football? Do we allow soccer? I don't, you know, people are talking about that and worried about it already. What's the best advice to parents here?
Well, I think from my perspective that my answer is kind of gray, which is that we don't really know enough to start saying that nobody should play football or nobody should play soccer. I think that we have rightfully more concern, but I still say that the primary focus for people should be on the proper management of concussion, because concussions are going to occur not just in sports, but everywhere.
All right, let me throw one other thing at you. Maybe, Mark, you can talk to this issue too, or both of you. But, you know, and I'm not trying to impress you with all my reading, but the Peltzman effect, there was a study done, and what this showed was, you know, we can improve the safety of activity. We can improve they're specifically looking at football helmets. You know, it used to be a leather cap, right? Now it's this fairly sophisticated thing you put on your head, right?
Which this hard plastic thing has made it easier to put a guy's helmet in the chest.
There you go.
With a leather helmet, you'd keep your head out of the way.
But what they were saying, what they're saying is, you know, we as humans compensate for this safety feature by taking on more risky behavior.
Right.
And radical as it is, what they said was, I wonder what would happen to the game of football if we took the helmets off.
Right, right. And they talked about, Mike Ditka and Joe Paterno had said, what if we take the face mask off the helmet? Well, nobody's going to put their face into somebody's shoulder pads if they didn't have protection.
Where are you on that? Is that crazy?
Well, I can tell you what we've done at school with our football team. We practice something called, the Seahawks came up with it. It's basically rugby tackling. Rugby is a very physical, violently physical sport, but with no helmets. They tend to keep their heads out of the way. Not that they don't get concussions, okay? But we, you know, the Seattle Seahawks have come up with this tackling technique, which we've taken on over the last 2 years, and basically we're trying to get the shoulder to the inside hip versus the head across, which head across ended up being head ended up in the chest.
Right,
And so we're keeping
Dr.
the head out of the way.
Beeger, you have 2 daughters. They play sports?
Yes.
Do they play sports that have rates of concussion?
Yep.
You okay with that?
Yep. Absolutely, and I say that all the time. And my daughter just stopped playing soccer. She's focusing on dance, but she played soccer up to her sophomore year. And I lead many of my talks in the community about this by saying, my daughters play sports. They play sports where there's risk of head injury, and I'm not worried about them getting a concussion. What I'm worried about is they're going to be at an away game and nobody's there who knows how to recognize or properly manage.
That's hand in hand. So you worry about a concussion. Again, it goes back to the treatment, but
yes, the management.
You can't control the treatment at all stages.
Correct. But I think the focus should be not on. You can't completely prevent a concussion, and we have to recognize that when a concussion occurs, in most cases, it's a relatively benign event. But if we don't recognize it, the chances of it becoming something more than that are greater.
Okay, and that's my last question for you. Sorry here. So the chances of it becoming more, you know, what is or are the long-term impacts here? If one of my daughters sustains a concussion, do I have to worry about that for the next decade and a half?
Certainly not if it's her first concussion and if it's properly managed. Where we run into trouble, and it's common sense, Dan, if you injure your knee and it still hurts and you go out and play again and it gets injured again, you're probably not going to have as good outcome as if you waited. It's the same thing with the brain. The problem is we don't feel the brain the way we feel the knee, and it's invisible. And we don't have a way to diagnose that the way we would other injuries. But the principle's the same. Our main focus in sports, and I think Mark would agree with this, is when a concussion occurs, do everything we can to minimize the risk of re-injury prior to full recovery. That's really what our focus is about. I would add that especially in the school setting, we've learned that if the injured brain is forced to work harder than it really wants to, because it doesn't have the energy, it's trying to heal and it's not working right, that also can actually complicate and prolong recovery.
That's one more thing that I
No,
can
no, there's no more one thing. Dr. Brian Rieger, thank you so much from Upstate Medical University. We're completely out of time. Great advice tonight. And Mark Powell from ESM, as well as with the Syracuse Crunch. Good advice from you as well. We could have gone longer, obviously. My apologies, but thank you to you both.
Thank you, Dan.
You can visit us at foxsyracuse.com. Send us any questions, comments, or ideas for future shows. foxsyracuse.com. That concludes this edition of Central. From all of us here at Fox 68, I'm Daniel Pluff. Thanks for watching.